Hi, my name is Lexie, and this is my micro lecture presentation. I chose to choose the media podcast of The Pain Management Doctor Was a One-Man Crime Wave. Within this presentation, my outline will be the overview of the podcast, what does this mean to the United States, healthcare and ethical issues, prevention and statistics, and my thoughts. So within the podcast, which was hosted by Todd Silver, he interviewed Chris Covington, who is the Assistant Special Agent in the Department of Health and Human Services. And this podcast was going over the overprescription of opioids by Charles Fred Gott. Dr. Gott started as a cardiologist, but eventually transitioned into a pain management physician in Kentucky. Dr. Gott thought that this time as the cardiologist was not profitable for him, and he would make more money in pain management. Within that time, in 2016, nearly 1,000 opioid-related overdose deaths in Kentucky alone, and in May of 2018, Dr. Gott was sentenced to 8 or more years in prison for the tremendous damage he did to a small community by overprescribing opioids. So what did Dr. Gott do exactly? He ran unnecessary tests on patients within months of each other, like an EKG, which is typically done on patients that have heart conditions every 3 months, and a spirometry test, which is a test to check your lung capacity, which is typically done during a physical. Unless you have some type of respiratory disorder, it is usually very unusual to get this test done on a regular basis. He did not require diagnostic procedures like an MRI to pinpoint the pain, like pain management doctors typically would do, and he did not refer patients to see physical therapists to relieve the pain rather than using medication. Dr. Gott was a top prescriber of methadone, which is used for treating opioid addictions, and very few doctors prescribed this opioid in the western Kentucky area which he was located. His original thought was that if he got people addicted, they would have to keep coming back to him, which was his whole plan of making more money off of this. So the effects to the community Dr. Gott caused were tremendous. The patients that were addicted, it impacted their families greatly, the ability to hold a job and finding their way to an ER and possibly even death. Within the podcast, it was discussed that one patient overdosed twice, and her mother even confronted Dr. Gott that if he did not prescribing her daughter opioids, she would eventually die. Many prescribers that overprescribe are damaging their communities that result in big consequences. Within this podcast, they also talked about how they are preventing overprescribing opioids, which was through the opioid fraud detection units, which is resources to identify doctors that are overprescribing, hire dedicated opioid prosecutors to handle cases like this. Some further statistics that I found on opioids is it is a disorder. It is a national health concern, one of the top concerns in the U.S. 3% to 19% of opioid exposure develop chronic dependencies, and every 6 minutes in the U.S. there is a fatal overdose. Overprescribing opioids started in the 1990s to the early 2000s, and about 70% of patients that have leftover opioids store them to use later on. Some major factors that increase the risk of addiction that should be taken note of is chronic pain, younger age patients within 18 to 45 years of age, personal or family substance abuse history, life stressors, mental health disorders, and prolonged use for more than 7 days. So my original thoughts within prescribing opioids, there's acute pain and chronic pain. Opioids can be extremely effective for short-term pain, but it's a big issue that is being prescribed for chronic and consistent pain, which leads to overuse and addiction. Within that, providers should be ensuring appropriate treatment and preventing opioids from becoming an issue and entering the market. Oftentimes, people who struggle with addiction problems are not treated with care, and we need less harmful and more non-opioid pain management options. There should be more education for prescribers of opioids as well as further prevention at pharmacies. And although doctors do play a role in overprescribing opioids, it is not just doctors that contribute to the issue. Pharmacies, the healthcare system, and even the patients contribute to this issue. These are my sources that I used for this presentation, and thanks for listening.